Welcome to Kenton Teaches. Enjoy the video.
You begin by confirming the prescription and why each component is needed. This reduces dosing errors. Once done, verify medication names, concentrations, and expiration dates against the order. Make sure a sterile field and proper disposables are at hand, and that you or a qualified colleague will perform the task. Why this matters: verification prevents wrong drug events and contamination. If any discrepancy appears, stop and escalate to the prescriber or pharmacy rather than guessing. You should now focus on compatibility and professional guidance to avoid chemical incompatibilities or loss of potency. Make sure the prescribed combination is supported by reliable references or approved pharmacy preparation instructions, and consult a pharmacist if anything is uncertain. Keep the environment controlled and reduce open vials time. This preserves sterility and efficacy. Make a clear record of lot numbers, concentrations, who prepared it, and the time, because traceability matters for safety and potential recalls. You complete the process by verifying the final product against the original order and labeling it clearly with concentration, volume, preparer, and time. Once done, store it under recommended conditions and hand off with clear administration instructions. Make sure another qualified person performs an independent check when required. This reduces administration errors. If anything looks wrong, such as unexpected color change or contamination, quarantine the product and notify pharmacy and the prescriber immediately.
Thanks for watching. Please subscribe if this video was helpful.